All right, so we have a kick-ass program for you today. We put together a bunch of different topics in order to be able to cover important things that Firefighter have asked us to discuss during the symposium this year. To begin those sessions, we have two opening speakers. We'll be joined today by David Bernswig from the International Association of Firefighters, as well as Kevin Quinn, who's joining us from the National Volunteer Fire Council. They'll be setting the stage and setting the tone this morning for our topics to come. This morning, we'll be covering 4 specific overviews. The first one will be modifiable risk factors among firefighters. Topic number 2 will cover exposures and survivorship. Topic number 3 will be an update on national projects as well as what's going on here in the state of Florida through the Firefighter Cancer Initiative. Topic 4 will be bringing it home, how you can implement what you learned here, the knowledge that you gained through your workshops yesterday, and the topics done in the symposium to take it back home to your home departments. So to begin, I want to welcome our first opening speaker, David Bernswig. He currently serves as a Director of Health and Safety in the Fire Service for over 35 years, the past 25 in the Columbus, Ohio Division of Fire. David served as the Director of Health, Safety, and EMS for the Ohio Association of Professional Firefighters since 2013. He is a member of several Nfpa technical committees, including Occupational Safety and Health, Emergency Responder Health, the Correlating Committee for Protective Clothing and Equipment, and Respiratory Protective Equipment. He also serves as the Interagency Board for Emergency Preparedness and Response. He is a safety officer for FEMA, the Urban Search and Rescue Team of the Ohio Task Force 1. Please join me as he brings a note and a message from the International Association of Firefighters.
Next button? Yep. Okay. Thank you, Alberto, and thank you for the planning committee and everybody from the University of Miami who putting this together and all the great work you're doing here. I am the newest member of staff of the IFF in health and safety, and up until, I think today, I've been known as the new Rick Swan. So Rick retired and moved on. But then Rick called me, and not Rick, but Pat called me, and he's got stuck at the board meeting for the IFF. Pat's doing great, but he's in Hollywood, Florida right now. And so now I think I am, instead of being the new Rick, I'm just going to be the Pat stand-in. So I think it's a promotion. I think so. Okay. So cancer in the fire service, obviously this is something, we've all been talking about and thinking about for a long time now. It's leading cause of line of duty death. We have 138 out of the 251 names that we're putting on the wall in 2021, or that will go on the wall this year for 2021, were related to occupational cancer, right? So, what's going on here? Right, we're starting to recognize it is the big thing that's going on, and what are we going to do about it? And I've personally been working in this for about 15 years with occupational safety and health with the Nfpa committees, trying to get movement on it, and I know everybody here has been doing the same thing. We've all been trying to get a lot of movement on this and making change happen, and we're starting to see it. We're starting to see it in a lot of ways. So standards are one thing. This is the prevention piece, and the IFF has 61 representatives covering over 100 standards. So in related to cancer exposures, right, we deal with PPE, preliminary exposure reduction, contamination control, exposure reporting, facility safety, right, and respiratory protection requirements. And there have been a lot of changes. So if you haven't been keeping up with the standards, a lot of big changes, and I would say probably the biggest one, well, 1,500 we changed about 2 editions ago, and we're going through a revision of that right now. But in 1584, which was historically the Rehabilitation Standard, we rewrote that whole document a couple years ago, and it came out last fall, and it is now pre-habilitation, contamination control, rehabilitation, and post-incident recovery. So it kind of goes through the whole gamut of, are you ready to take the run, back to, are you ready to take the next run? And looking at how you deal with on-scene decon. And it's a very high-level look at what are the best practices. So I highly recommend you take a look at that. It's out right now. But that's going to maybe be a placeholder for what's coming next, right? So NFPA 1585, I know there's probably a handful of us in the room that are involved in that. There's a lot of, that's a new committee that got stood up. And that's where occupational safety and health, the NFPA committee on that, which was 1,500 and 6 other documents, got split up into emergency responder health and occupational safety and health. So this falls under emergency responder health, 1585 does, and it's going to look at, it's a contamination control standard. And it'll be from, soup to nuts, basically everything as far as contamination control on the scene and what we do in kind of incorporating preliminary exposure reduction, which is in 1851, and great work by that committee as well, but a lot of good things are happening. So there's some, I don't know if you can see the dates on there, but that is open for public input right now, and that's for the first draft, and we'll go through a second round. So by all means, get on there, nfpa.org/1585, and you can look at where it is currently. And again, it's looking at station design, things like that as well, which is also, by the way, currently in 1500. So a lot of these best practices we're saying, they're in the standards. So prevention is obviously the key, and mitigation is the key, but the next thing we need to do is surveillance, right? Because we're not going to, it's a dirty, dangerous, and difficult job, and we're not going to be able to avoid the exposures that we're getting. And so, working with the IFC, we've developed the Wellness Fitness Initiative, which very closely, follows 1582 and has recommendations for best practices, and a lot of great information and surveillance for early detection of cancer. Right, we recommend annual medical cancer screenings, and there's some great presentations, discussions about that yesterday, and I'm sure more today talking about that, but 1582 is the standard that we should be looking at for our annual medicals. And then the IFF has really been involved in partnerships with other organizations. In December, we signed a memorandum of understanding with the American Cancer Society, and we have more information on that, iff.org/fightcancer, and that's going to provide our members to many resources that are available through the American Cancer Society. Also, we have partnership with the National Firefighter Cancer Support Network, and we work with them and on training and education of our members and support for members if they have cancer. There was a presentation on that yesterday, and I'm sure by now everybody's aware of the work that they're doing. And so we're working along with them. Also, January, we just had our Cancer Awareness Month. We partner with them, putting that work together. And doing everything we can to get our members educated as to the exposures that they're getting and the prevention and surveillance and mitigation, everything we need to do. How can fire departments and unions get involved, right? We can create screening programs, research projects, right, at the local level, also with the Firefighter Cancer Cohort Study, National Firefighter Registry, which should be going online later this year. Exposure reporting, right? NFORS is a wonderful tool for exposure reporting. It follows you throughout your career, through multiple departments, and it belongs to you in a national database. If your department's an NFORS department, your incidents are automatically uploaded into the system, so it's a great tool for tracking your exposures. And I believe with NFORS also, once you're on that, you can. I know in my department, we were able to basically link to and register for the Firefighter Cancer Registry directly through that process. So everything's starting to work and come together and link together. Not on here though, but another way that we can get involved, and there's a lot of talk on that, and Alberto mentioned, we're going to be talking about how do you bring this change home. But that really is the key, is advocating and making real change, right? It's one thing that we sit here, and we've been talking about this for a long time. There's awareness out there everywhere, but there are very few places outside of Southern Florida, which is, on the tip of the spear when it comes to this stuff, but there's very few places that are this progressive, right? We're talking about it, firefighters are aware of it, but when you're on the scene, you get kind of tunnel zone, you get stuck doing it, and we're not always doing preliminary exposure reduction. We're still bringing our gear back where we shouldn't bring in our gear back. And I believe the reason that fails is because we don't have the support systems, right? You need the support from the department. You need systems in place so that you can make change, right? You can't just tell a firefighter, hey, when you're done with this fire, go ahead and get clean gear. Change your gear out, get a shower, when we don't support them, right? As a chief, I get back in my car and I drive away. And, you know, they're left with, oh, that sounds great. Now, how do I do that? Right? Because we didn't have a system in my department that really supported that. And so we've got to do more where we have on-scene change-outs and cleaning and things we can do so that we're not bringing it back to the firehouse. Research we're involved in. So the IFF has been closely involved in a lot of research that's going on out there. Dermal wipe study, University from Ottawa, Canada. And that study is very close to completion, but looking at the effects of dermal wipes before and after exposures. A lot of flame retardant studies that were involved in the US and Canada. We were looking at dust studies in firehouses in the US and Canada, looking at, I believe, 25 samples that were taken. Flame retardants were found in all of these. Look back at those samples also, PFAS was found in all these. Still have to determine where this stuff is coming from. Again, probably a lot of it is cross-contamination. There's a lot of these things are in the environment, but more work is needed. But we know that the PFAS and the flame retardants were found at higher levels in these fire stations than they are found in the general public's homes. Working now on a lot of PFAS work and studies, looking at, again, the dust, the blood, and in that study, the blood studies should be coming out here in the next few months, and also in gear. And that gear, that's the picture on the right, is the Monsterman Study that came out in December. And what they identified, they looked at 4 sets of gear, one set from 2009, and 3 sets from one from 2008, 3 from 2019, and found that there was PFAS in all 3 layers of the gear. And these were new gear, by the way, all new gear, and that PFAS was in every layer of the gear it's located. So we expect to find it in the moisture barrier, right? It's a PTFE barrier. It's obviously it's going to be loaded with it. On the outer layer, we expected it because it is, you know, part of your durable water repellency, or has been part of it, actually. So my understanding now is that the 2 major manufacturers of outer shells are no longer using a durable water repellent with fluorine. So whether you specify it or not, they've just gone away from a fluorinated water repellency, unless you sign a waiver, which, you know, we're not encouraging you to do. But the gear research, you know, there's certainly a lot of a need to understand where this is coming from and do more research and understand the impact of it, because there's going to be a lot of trade-offs. And that really has got us working with a lot of our partners and thinking about kind of the next step. Right? How do we start working at what does the next generation of protective clothing equipment look like, and what are the balances and trade-offs that we have to take to be able to get that our protective equipment isn't what's harming us, right? That's the talk of the town, right? That's the big issue in the fire service today, is that why should our protective equipment be hurting us? And so we want to understand that, and we want to understand the trade-offs for it and how to better mitigate that as well. And then cell tower research. The IFF funded a pilot study on cell towers that were near firehouses, and we're looking to expand that into a larger study as well. And that's all I have. If anybody has any questions for me, I'll be around all day. Thank you for your time.
You know, Dave, your remarks makes me think about how in the United States we spend so much money in the healthcare system once a person gets disease versus prevention, and it's so good to hear about all the different things that we could do before to make sure that we don't get to the disease state. So thank you for sharing what the IFF is doing at the national level. Okay, so continuing, I'd now like to invite First Vice Chair. Kevin Quinn from the National Volunteer Fire Council. So Chief Quinn joined the fire service in 1976. He recently retired as the Deputy Chief of the Union Fire District in South Kingston, Rhode Island. And he has returned to where he began in the volunteer fire service, actively responding to fires and alarms with his original station number 3 of the Union Fire District. Kevin is a past president of the Rhode Island State Firefighters League, the Rhode Island State Advocate of the National Fallen Firefighter Foundation, Where Everyone Goes Home, Courage to Be Safe program. He is a member of the Foundation Rhode Island Local Assistance State Team, a member of the Hope Valley Hazmat Team, and a member of numerous federal, state, and local exercise design management teams. Please join me in welcoming Chief Quinn. Thank you. Okay, green button.
Thank you, Alberto, and I want to thank the Sylvester Comprehensive Cancer Center and the Planning Committee. We're certainly gaining traction. There's no doubt about it. As David said, it's been a couple of decades. The IAFF started their first research, but we're gaining traction because of a partnership like this, where we're bringing scientists together with researchers, the fire service, and government agencies that are supporting to some level what we're trying to do to mitigate in the exposures that we have in the firefighting realm that we work in each and every day. I want to acknowledge a couple of board members that are in the audience. I know David Yurzik from Minnesota is here from the MVFC Board of Directors, and Paul Acosta is here in person, and there's a number of board members that are on virtually as well. And I really want to dedicate this to Brian Mcqueen, who's the director out of New York for the National Volunteer Fire Council. And I'm pinch hitting for Brian because Brian is a cancer survivor, and his oncologist told him recently that he was unable to be in large gatherings. So he would be delivering this message to you today. So I'll deliver it through him and for him. And I just want to say thank you to Brian and all of those directors of the National Volunteer Fire Council for what you do each and every day. The MVFC represents 69% of all firefighters in the nation. Those budgets for those volunteer departments are not anywhere near what we see in the metros. So we have a lot of challenges to bring this message, because cancer affects career and volunteer just the same. Our numbers are incredible. I went to the workshop yesterday on implementation of what you can do in your fire department, and the little band of those 31 of 33 firefighters that chief was showing really resonated with me, because when I talk to families and we look at the amount of services we go to for cancer and occupational cancer deaths in the fire service, it's just truly overwhelming. But I do want to say, my story is the fire service saved my life. And the fire service saved my life through a firefighter physical. I'm not a cancer survivor. I'm a cardiac survivor. At my physical in 2016, depression was picked up on my cardiac, on my EKG, 12 lead, which led to a quadruple bypass surgery from the physical. So number one message is the importance of physicals for firefighters across the nation, whether it be picking up cancers or whether it be cardiac or anything else that is picked up during the physical. So the change in behavior is to make sure that you take advantage of what's out there. When we have scientists together and looking at the research, it's a tribute to the work that goes on and the funding that goes behind that. So what I want to do is I want to kind of delve into my history. This is my 46th year as a volunteer firefighter back in Rhode Island. And in the first 3 decades, I think it's important for the scientists to know this. The first 3 decades, I would have my bunker gear near my bedside, in my bedroom, in my home. And when the alarm came in, I'd jump in my bunker gear, I'd run down to the front door and pick up my coat and helmet. I literally lived 2 houses from my station, so I would run down to the firehouse and get the rig and go to respond to the alarm. And so many times I would come back home, undo what I did, leave my jacket and my helmet near the front door, and up to my bedroom, my gear goes right next to my bedside. When I came back from a fire, a working fire, my wife obviously knew we had a working fire. She shut off the pager a long time ago. She wouldn't even listen to the calls. But I'm just thinking of the off-gassing that was going on in my home, affecting me and my family all those years. We're changing that attitude, that adjustment, and clean gear, and what we do with the gear, and separation of the gear. So those are the messages we're pushing out to the volunteer fire service. We're pushing it out through means of what we had in terms of the association with the IFC, a VCOS section, a Volunteer Combination Officers section in the MVFC, and we built in there the the Lavender Ribbon Report. Prior to the Lavender Ribbon Report, in 2016, early, the Alliance, the Fire Service Alliance came together under Dennis Compton's leadership. And what I found on that call, that alliance, it brought together all fire service organizations, the IAFF, the MVFC, the IAFC, investigators, all of those partners joined into this alliance. And that alliance engaged the fire service along and worked closely with researchers and scientists. And I saw that in 2016 as the unity of the fire service. I really found that cancer is bringing together the fire service. There's been too many times in my leadership years at the national level when I've been in a congressman's office or a senator's office, and they will say to me and us, when you, the fire service, get together, then come and talk to us. We're pushing for funding for AFG or SAFER or whatever it is. When you, the fire service, get together, come and talk to us. Well, we are together. We are together. We are together with the push for this cancer and the mitigation and reduction of our exposures and what it is that we have on a day in and day out basis. So I'm proud of the fact that we came together as a fire service. The Lavender Ribbon Report started in 2016 in Grapevine, Texas at the MVFC Training Summit, where Brian Mcqueen out of New York and Jim Seavey out of Maryland were sitting at a table early in the morning before the training sessions, and they were jotting some notes down at breakfast on a napkin, and Brian tells me he still has those original notes. But that napkin led to the ideas behind the Lavender Ribbon Report. The Lavender Ribbon Report was initiated by what I called, as at the time I was the chairman of the MVFC, I called them my cancer dudes, both Jimmy Seavey and Brian Mcqueen. They were both fighting with non-Hodgkin's. Unfortunately, Jimmy has since passed, and he did not get to complete his writing of the Lavender Ribbon Report. But the authors that stepped up from those original notes, those originated ideas, and put out that Lavender Ribbon Report, and that was written so that we could have some adjustments without a lot of cash flow behind them, those 11 best practices, so that we could make a difference in reducing the exposures to carcinogens. And that Lavender Ribbon Report has recently this year been updated. And I'm very proud to stand here with the IAFC, VCOS section, and the MVFC about the work that we've done with the Lavender Ribbon Report, the original, and the update. It is making a difference. It started with the 11 ideas, the best practices. And now the second revision of the Lavender Ribbon Report is there, which is applications. And that's really where we need to go. I said we're gaining traction as a fire service in terms of mitigation and reducing exposures to carcinogens and the reduction of cancer in the fire service. It's critical that we get the message out. There are challenges. It's, as David said, it's easy to tell them that it's best that you do this, but we need to support as well, and that's what we try to do on the national level. When you look at what we're in and where we come and how much we've gained in that traction, I'm proud to say that there's movement in the right direction. But it comes down to this partnership. We make a difference in working with, the researchers and finding. It's not that I was foolish to leave my gear by my bedside. I was just unaware. It's just the same thing is true with fire poles. Fire poles in the station house. Above the apparatus and above is the living quarters. We've learned a lot about ventilation, exhaust, and extractions, and no smoke, or whatever it is that we could do to protect. But it's building design, station design, and those things that we're looking at to make a difference. Brian, I left this slide in for you because this was Brian's slide. For me, he said the change was very difficult to overcome. The message that Brian had is, it will never happen to me attitude. That's what we have to change. And that's what we push for on the national level, pushing out to our state associations and making sure that we are allowing our firefighters to make better decisions. And again, it's critical that we move that way. The studies that we have come out with are just tools in our toolbox, and that's why I appreciate this relationship we have with the Sylvester Comprehensive Cancer Center and all of our researchers. We're continuously, through the Health, Safety, and Training Committee, trying to support those projects that are going to affect in a positive way the fire service. So we're there to support and build those partnerships as well. Some of the studies that come out, they bring awareness to us so that we don't have our fire gear near our bedside, and we don't put in poles in living quarters above the apparatus floor. You know, why does one firefighter contract cancer and yet another one doesn't? How is it that all those years and all that smoke, carcinogens, that I never was affected by cancer? Why not me, but why Brian? You know, that's what we're looking for from you as researchers and scientists, and looking at that family impact, you know, and those sad, tragic stories of those family survivors of our loved ones that we've lost through occupational cancer. And then, you know, other questions for the researchers. You know, can you get cancer from a single event? You know, what are those designated carcinogens? And what causes cancer in the fire service? And I know there's a lot of things going on that are going to determine and help us find answers and bring us solutions. Together we can make that happen. Just a quick bit on leadership. You know, what type of leader are you? You know, what is your helmet? The helmet tells a story. That helmet on the left is a fire chief. Maybe he's never been in a fire, I don't know. Or maybe he's just cleaned his helmet to send a message. You know, or are you still that salty firefighter? And we still have that out there, and we have to change that attitude as leaders in the fire service. We want to avoid these tragic deaths like Jim Seavey and all those others that are on that list, or on that parade that I saw yesterday, or on the wall in Boston. And I do want to give a shout out to Ed O'Kelly and the IAFF for the work you've done and what you've made a difference. And I also want to thank the researchers and scientists, because we need you. It's important. It's great that this started 4 years ago, and it started with a handful of people, Alberto, and now it's grown to the numbers it's at. But again, all I can say is we're gaining traction, and we need to keep that going. And keep it going by pushing forth that message of we make a difference. We have resources that are available. I wanted to leave with this message of Brian Mcqueen's words. You know, when he sat in that doctor's office, and I'm sorry to tell you, you have cancer. We need to avoid that. We need to reduce that. We need to do all we can to make that difference. Additional resources we have out there, and the MVFC is here. We're here to represent those 69% of all firefighters. We're here to work together collaboratively and build partnerships, and we know that cancer it is the #1 killer of firefighters, and we're committed to make a difference. Thank you very much. Thank you, Alberto, and thank you all.
Chief Quinn, Chief Bernswig, thank you so much for those amazing messages. You inspired today's symposium and drive the message home about prevention and getting it done. So now we switch gears. We're going to do topic number 1. Thank you for sharing those messages with us.